Welcome to Sex Talk Radio, a podcast that explores kink and sex through candid and curious conversations. Join me and expert guests in exploring taboos and unpacking what it means to be sex and kink positive. Go check out our new website, sextalkradio.com. That is SEGGS talkradio.com. And I hope you enjoy the episode.
You can run, but you can't hide.
Yeah.
I think a lot of people with childhood trauma too, they like try to move away from where that trauma happened. They're like, it'll be different in a new city. But you know, the phrase, wherever you go, there you are.
Yeah. Yes. I'm so excited to introduce you guys to Butter. Butter Wellness makes external prostate massagers for men. They're extremely high-powered, no insertion necessary, and they give really incredible prostate orgasms. You can get 20% off by going to butterwellness.com and use code SEX, SEGGS. This episode of Sex Talk Radio is brought to you by the HUD app. The HUD app is changing the face of modern and casual dating by giving users a really fun and flirty interface, and also it has bedroom features where you can select all of the kinky and naughty things you're into and show those to potential future partners. I personally love using the HUD app, and I think it's a great system for finding kinky people near you. Go to hudapp.com/sextalk. That is hudapp.com/SEGGS talk, TALK, for more. One of the many things that I love about Mochi Melt is that it is an overall luxury experience using it. It tastes delicious and it looks gorgeous on the nightstand. If you want to try out Mochi Melt for yourself, go to mochimelt.com and use code THEA, THEA, for 15% off of your entire order. I recently created an account on sensually.com. It is an online platform for people to seek out and offer sensual and sex-positive experiences. This can look like being a BDSM provider, a sex coach, a escort. It covers a wide range of themes, and you can really find what you're looking for. And it is completely free to create an account or to explore. To learn more and browse both in-person and virtual experiences, go to sensuali.com. Hi, Allison.
Hi.
Welcome to Sex Talk Radio.
Oh, thanks for having me.
It's a long time coming.
Oh, yes.
You and I connected, I think it was when I maybe posted about who wants to do something in the Sexy Society. Is that what it was? Or?
Yeah, I think you were posting like you wanted professionals, or maybe you were wanting topics.
Yeah.
I can't remember.
Yeah.
And I said like, oh, I'll come do something.
Yeah. I was diagnosed with ADHD about a year and a half ago now. Mm-hmm. And so I've been really curious about like how that relates to sex and different neurospicy things, mm-hmm. as the TikTokers call it. Mm-hmm. And we had a really cool session in the Sexy Society, and you had some really cool research that you brought, and it just like blew my mind. So I'm glad we're here.
Yeah.
Thank you for flying to Austin, Texas.
Yeah. All the way from Ohio.
Even though your cat just birthed babies.
Oh, yeah. 2-day-old kittens at my house, 4 of them.
How did that all go down? Do you have a male and a female cat?
No,
or?
I have a female cat, and she was in heat.
Was
she got out.
She was out hoeing.
She escaped.
She was being a little...
She did.
Wow.
Yeah, she escaped, so...
Trying to get it on.
Yeah. She knew. Maybe I should have brought her.
Here's my guest. How did you know? Was it like all of a sudden you're like, is my cat fucking pregnant?
Well, she was gone for like 24 hours. So we were like, she's probably pregnant, because she was always trying to get out when she was in heat. And then they kind of show symptoms early on. And so I was like Googling, and I was like, oh, she's pregnant, isn't she?
Damn. Animals are fascinating. I mean, at the core of it, like, we're just animals too with sex stuff.
Yeah.
Like,
she's like so proud of herself though. Like she in all the photos, she just looks so pleased with herself. And I thought it was...
I got fucked.
Yes. And it's just like, I thought it was just me, and I sent my friend the photos of her.
My God,
and my friend was like, why does she look so proud? I was like, oh my gosh. Right?
Yeah, animals. Well, I get really tripped out by like noticing my own behavior kind of from a zoomed out perspective, mm-hmm. based on my cycle. I'm very in touch with my cycle, and like I do crazy shit when I ovulate. And then like when I'm PMSing, I'm like, I just want to be a cozy good girl. And it's like wild. Like the kinky adventures that I have are when I'm ovulating, and it's like my body is trying to go, I don't know, make babies.
Oh yeah,
our
it's
bodies
very
are
intuitive.
Fascinating.
It's so strange. Like our bodies also like, I think, will like shut off our ovulation if they don't think it's the right partner.
Ooh,
so like I was
theory.
actually like off my birth control for like a year and a half in my previous relationship.
Yeah.
And I never ovulated, never had a period, went to the doctor, had hormone levels done.
Shit.
Like they tried to give me pills to ovulate. I was like potentially trying to conceive a child.
Sure.
Couldn't ovulate, couldn't have a period for a year and a half.
Fascinating.
Get out of that relationship. I'm out a few months. I'm in my own place. I'm in a new relationship. I start ovulating like clockwork.
That is.
Which I've never done.
Yeah. Wow. Yeah. Your body.
So now he's taking credit. I'm like, don't.
Yeah. No, my body didn't want to. Yeah.
A little bit of both, you know?
Yeah. Are you in touch with your cycle in the same way?
Yes.
You're like, I feel like I'm ovulating. I feel like I'm peeing.
Yes.
Like it's so
well, because I'm looking
powerful.
for it now. Because I'm like trying to like track it and like cycle track and like, especially when I had my first ovulation that I'd had in like years, because I'd been on birth control for years, I was trying to like look for signs and track days and stuff.
Yeah.
And so I started to be really intuitive about it. And I was really surprised at all of the cues that you can pick up on if you're really like looking for it and being in touch with your body and everything.
Yeah.
I don't know if you've ever done the ovulation test. You have to do them like every morning for at least a couple months to like kind of like track it.
Oh, wow. Mm-hmm. Yeah.
So it's like pretty like regimented, and they're just like pregnancy strips, like the little ones.
Right. I've seen those. Yeah.
And so, but it's really interesting to watch it. You can even like watch the line get darker, and then you can like see where.
I swear I know the day.
It's wild.
Because what happens is what you're going to know, progesterone drops after you ovulate.
I think so. I'm not an OB.
Okay, sorry. You're supposed to know all medically targeted questions. No,
unfortunately,
I'm just kidding. Your progesterone drops like after you ovulate, because your body's like, we don't need to be doing this.
Yeah.
We don't need to be literally trying to get you to go make babies now. And it is like, for me, it's like literally the day after, I feel like tired, depressed, but. Anyways, we jumped in. Why don't you introduce yourself? A little bit of your fun qualifications and all that
fun,
stuff.
Of course. So I am Allison, and I have worked in mental health for about 10 plus years. I started as an RN, and I worked in inpatient psych units, like locked psych wards.
Wow.
I did forensics, like criminally committed people. And then I did some civil units. And then I graduated about a year and a half ago from nurse practitioner school. So I'm a mental health nurse practitioner. And then for the last year or so, I've been working in an outpatient clinic, diagnosing people with mental health issues and prescribing meds. And I have a handful of therapy clients. So just like a little bit of everything.
What drew you to that initially? Because you've been in it for a long time.
So like in nursing school, you do all of the different rotations, and you kind of like get a little taste. Like it's like 7 weeks of like all of a bunch of different specialties. Yeah.
For you to kind of figure out?
Yes.
Oh, that's
so
cool.
like you have coursework, and you have lab, and you have like clinicals.
Yeah.
And I really resonated with like ER, ICU, and with psych. And when I graduated, I had an interview for a psych job and an interview for an ER job. Didn't get the ER job, went into psych, and I just loved it.
Yeah. It's fascinating.
It's fascinating. And I think like I grew up like so sheltered. I think it really like changed my worldview in a positive way and made me like a more compassionate and understanding person.
Yeah.
And just so sensitive to like energy and what's going on. Like when you walk on a psych ward, you can tell if you're experienced, like if it's going to be a bad day or it's going to be a good day. Like it's like something in the air. Yeah. So like you have to be like.
There's collective energy that you found working there. Wow.
Anybody who's worked there for a long time would tell you that.
Whoa.
Because like when you've worked this many jobs in that, like it's like any job, you have coworker friends from your jobs from the years.
Yeah.
And so any of the ones who are experienced, they'll be like, oh yeah, it doesn't feel good today.
That's sad though, just thinking about the people that are suffering or struggling.
It's really, it can be really hard. It can be really rewarding, but also just really tough, I think, because you really have to be able to set aside whatever you're doing, because all of the energy there is so contagious.
Sure.
And
try to create energetic barriers too, of like.
Yeah, you don't want to be giving negative energy to someone who's already got so much.
Yeah.
You know, because they're already at, like, if somebody's committed to a psych ward, they're at the worst place that they really feel they could be at. And so, like, you cannot be carrying your heavy negative stuff in there.
Sure.
You have to
Leave
try
it at
to,
the
like,
door.
because it's not helpful.
Yeah. Wow. And so when you reached out to me, you were like excited and passionate about some of the things you'd seen and learned in terms of like kink and BDSM and how that's all involved in psychology, the origins of it.
Yes.
I would love to learn a bit more about like when you kind of uncovered all of that, or maybe it was related to the podcast, like when you reached out to me, but yeah.
So it was a little bit like over time. Like I think like a lot of things, like as you get more experience with something, you kind of get like, you kind of notice trends and you're like, wait a minute. And so like, I think it was kind of that. So specifically autism and BDSM, I kind of noticed a tie. And it starts to make a lot of sense because with autism diagnosis, we look at like more or less sensory output for them from the environment. So
output, you
touch,
mean
input
that they're taking
input.
In? Okay,
Yes, sorry, input.
No, you're cooking. Yeah.
So like touch, taste, feel, textures, smell, pain, hot and cold, right? So all of the things. And so I think it kind of started with like I was talking to patients with autism about sensory toolkits. Are you familiar with those at all?
No. Well, I think I need to go through the formal diagnosis, but I'm curious if I'm like slightly on the spectrum.
You mentioned
and
that before,
I'm not even like, I don't say that in a joking way. Like, I have ADHD, but specifically family members have started to point out a lot of like sensory stuff that I am sensitive to. And I'm like, there's a little crossover here. There is.
Yeah. And like if it's
or ADHD, there's also some of that as well. But like sounds, like I totally have like misophonia. Like if somebody's eating, like I want to freak out. Like I don't know. Anyways,
one of my friends
will diagnose me later.
One of my friends has autism and like styrofoam, just the look or sound of styrofoam, like she could literally lose it. Yeah. And I'm like, oh baby, that's autism.
Yeah. Anyways. Yeah. Okay. So autism.
So like sensory toolkits.
Sensory,
yes. So you're thinking about like if people with autism a lot of times will find like going out very stressful because of all the sensory input and just being out like in the workplace or at school or social things that they want to be at. Oh no.
I'm like,
And so
me like having a mental breakdown, leaving Megan Thee Stallion last night because there were too many people around me.
Yes, having a huge mental breakdown and not knowing why and feeling like it's such a dramatic reaction to what's going on, but not being able to calm down from it. And so one of the big things I talk to patients about is sensory toolkits. Okay, so having like a little toolkit in your purse, like things you can take with you. I think a lot of times one of the problems with psychotherapy and one of the problems with us as providers is we'll suggest things that are not portable. You can't do them anywhere or whatever.
Right. And put headphones on and lay in your bed. Imagine,
what are you going to do at a concert?
You're like the mental breakdown's happening. Yeah.
Yes. Yeah. So I talk about like different things you can take with you that are small and portable. Okay. So like a scent roller that like is just a scent you like. It doesn't need to be like a certain calming whatever. Something you like. Sour candy, because that interrupts a lot of the like you can focus on one sense instead of everything because a lot of it's the chaos. Sour candy or peppermint. Those are really good interrupters. Harnesses, because you can tighten them for
the kinky
pressure.
Ones?
Any kind of harness. like vanilla people wear harnesses and stuff too. It's like part of fashion. You know?
Yeah.
So like you can like tighten them if pressure's good. Some people like really like pressure.
Yeah,
that's
it's
very
like
common
the dog
for them.
Emergency thunder blanket.
Yes.
Weighted
or
blankets.
Like a weighted blanket. Exactly. But like portable, right?
Okay. Right.
Something like that's a good texture for you. So we're talking about bad textures, but something that's a good texture. So like velvet or fuzzy or whatever it is, like something small like a scrunchie or a hair barrette or something.
Hack for anyone with acrylic nails.
Yes.
I like getting like the little diamonds added on my nails because then I can kind of like feel them.
Oh, fun.
Because I can be really fidgety and fuck you to the one hater that commented, she's so fidgety, always touching her hair. Oh my
gosh,
I blocked him. But like, there's something about having those little, I can just kind of, it's like the fidget toys.
Yes. I have the rings. I like the magnetic rings that you like, they push and pull apart. I really like the tension. Have you done those before?
No.
With your hands? They like sell them in like packs of 3 and you kind of like, you put them on your hands and you can play with them.
On hands, not on your actual fingers.
Yes. Okay. Well, you can put them on your fingers. Yeah, they're like little. Sorry. You put them on your fingers and you can like pull on them. And like, if I have to sit for a long movie, like I went and saw Oppenheimer and that was like 3 hours long.
Oh,
and it was like
a nightmare.
It was so good, but it was too long.
3 hours is too much.
Too long.
Do you have do you have any diagnoses you'd like to share?
So I mean, my official diagnoses are ADHD, PTSD, and anxiety. Okay, those are the official diagnoses. I have also speculated, am I on the spectrum? Unclear evidence. There's a lot of
TBD.
TBD.
Same.
There's a lot of like overlap with CPTSD, like complex PTSD, and autism spectrum disorder, and so that's kind of like it can kind of mimic each other. And so when I've like brought it up to my therapist, she's kind of
Yeah.
She's kind of been like, I don't think so. And the big holdup is always like, I'm too social. That's always a big holdup. But then like how much of that is like gender, like society stuff of like girls expected to be social? Because like I meet a lot of like female dancers or cheerleaders who are actually on the spectrum.
Oh, wow. I don't think social, I mean, I think the whole introvert extrovert thing, all of it is like not that, I don't think you can diagnose somebody using that information. Like for me, podcast days, because I do 2 interviews back to back, I go home and I am like literally nothing. I can do nothing because this is so much for me to be so focused and connected to people.
And see, I find that to be exciting. Like I would go home and like do everything. I'd be like,
my God.
oh my God. Like I'm like hyped up about it.
Well, I asked you because I sense some ADHD and I fucking do the best with ADHD people because we can just keep going and like go at such a fast pace about multiple subjects and like we're on the same weird loops of subjects. I don't know.
Yes. Well, it's so crazy too because like my ADHD, like you're saying, like you sensed it right away, right? It was so obvious to everyone and I didn't get diagnosed till like 2 years ago.
Same.
I was like in grad school for my master's to like work in this field.
Right.
And my preceptor is who's like
What's
your
that?
clinical instructor. So like she does what I do, but I was like shadowing her and seeing patients with her to like learn the ropes.
Sure.
And she was my long-term friend from my first job. And we were sitting there the one day and like with nursing, you get to get up and go around. I always talk about like jobs that attract ADHD, healthcare, police officers, firefighters, because you get up and move. You don't have to sit at a desk.
Are ADHD people more like, I know that this can also be a trauma thing, but like feel very calm in high pressure situations?
Yes. Because they're used to chaos. So chaos
that's our
is
normal.
Comfort. Yes.
Yeah.
So chaos is
about
comfort.
this.
Yes. And calm feels like very uncomfortable. And so like
If you know me and you watch the podcast, you know that I like watching porn for my self-pleasure rituals. One of my favorite websites to go to is exoafterglow.com. What I have found with mainstream porn is that a lot of it is created for the male gaze. It's a lot about the man's pleasure, and it just doesn't feel super authentic and connected. What I really love about Afterglow is that it is for everyone, and it is founded by a woman. I've actually had the pleasure of working with her here in Austin, and I love their mission. You can also find educational porn on their website called EduPorn, and there is just so much to learn and watch there. So go to exoafterglow.com and use code EXOTHEA. As you guys know, I've been very curious about anal play with my male partners, and I'm really excited to share Butter with you guys. Butter Wellness makes men's sexual health and wellness products, including this perineum massager. This applied on the perineum, which is between the ass and the penis of a man, can create prostate orgasms, which are very, very intense orgasms. In addition to that, this tool can also create extra blood flow that goes to the pelvic region. So if anybody has any issues with ED, this can also support with that. This is not to be inserted. This is for external use only. And you can get 20% off by going to butterwellness.com and use code SEGGS, SEGGS.
I was in there and I was trying to sit in an office for the first time. And I was like so restless. And we had criteria for a patient who'd been screened positive for ADHD in front of us. And I looked at her and I go, I look at her, I'm like, do you think I have ADHD? And she was like, obviously. And I was like,
that's so
what?
funny. I know. Well, so many people like, and you actually really helped me learn about this on the live we did together of like the different fucking types.
Yes.
And you know, I remember having a friend and she was the more like aloof ADHD, like is never on time, is always late, is always like breaking stuff. Whereas I'm just like the hyperactive, hyper-focused one. Like I have no off switch. I'm always actually doing and producing. And she never, like, she was always like, you don't have it, you don't have it. But I didn't have her type. Like,
yes.
I have,
You have hyperactive and she has inattentive.
Oh, yes. Okay.
And some people have...
No, tell me about this. I love nerding
out
about this stuff.
There's also, like, combined types. So some people have both, like, bits of both.
Inattentive is...
Like, trouble with, like, details, times, schedules, all of that, right? Trouble sitting and paying attention. Hyperactive is, like, feeling, like, more of the symptoms, like the diagnostic criteria is like driven by a motor and stuff like that.
Yeah, and I'm exhausted. Well, it's like driven by a motor and then like crash sometimes for a couple days.
Excuse me, but when you're out, you feel driven by a motor. And like when you crash, you feel like very guilty about that because you want to like constantly go. Yes. And you feel like if you're not doing that, like you're so hard on yourself, then you're like not able to like, you're not living.
Literally. Like I will go so hard for a few days and then I'll be like tomorrow, I'm like, I have nothing planned tomorrow. So in my like today's proactive mindset, I'm like, tomorrow's going to be a nothing day. I just want to lay in bed. I want to do, and then I'm there and I'm like, you're a miserable fuck. You're worthless. Like, why are you doing, like, it's so wild.
Well, ADHD and autism, I would say they're like very freeing diagnoses in that way. The amount of pressure that people with both those diagnoses feel before to try to conform to like neurotypical society, which is like allistic. We talk about neurodivergent. So neurodivergent is like people with ADHD, autism on that spectrum. And allistic is like the neurotypical, like what would be like the standard, right? Okay. And so allistic people like don't feel like that kind of depression, anxiety from not being able to do those things the same way. But ADHD, autism people, especially without a diagnosis, they can be so hard on themselves because they're trying to be like allistic people and falling short. And they're just like, why can't I do what other people are doing? And why am I falling short? And it causes a lot of anxiety and depression and self-doubt and self-hate. And having that diagnosis can be so freeing where you're like, oh, okay, nothing's wrong with me. This is just the way my brain is.
Yeah. I mean, I still struggle with that, like looking at people that are kind of normal. And I mean, I also am just like, I'm the entrepreneur breed of ADHD too. And so I look at people that are like, doing like fun activities and hobbies and like have like this really active social life and it's just like sometimes I feel left out, or I wish that on the weekend I just wanted to go, I don't know, fucking paddleboard. I've never paddleboarded in my life, but like wish I wanted to do these like normal things when instead I'm at a coffee shop like building like an incredible thing. And so I've been trying to make more of an effort to find other entrepreneurs that kind of get it. But
you got to find your people.
It's
you got
to
find
hard
people
to not have FOMO of like the normal people.
I think there's FOMO, but then there's also like having compassion and understanding. Because if you were talking to somebody you love, I always tell my patients this, like if this was somebody you love or this was a child, like what would you tell them?
Right.
You would never be as hard on them as you're being on yourself. No. And so you're like, be gentle with yourself. You're doing the best you can.
Yep.
You can't do everything. We all have like finite time. So like you have to just like make the most out of your time. And do what you think is right and fulfilling, right?
Yeah, yeah.
So I think that that's like a big part of it is just like setting yourself free. Like, I don't need to stay till the bar closes. I don't like that. Instead of being like, well, everyone's staying. I'm obligated to stay. I'm already out.
Yeah.
Says who?
Yeah, I actually like an hour at the bar.
Says who? I mean, if you have a girlfriend there, you can't leave her. That's not safe, right? If it's just two of you.
Yeah.
But like in general, if you're in a group, who says you can't go home?
Yeah.
Go home. You did what you wanted to do. That's fine.
And it can take a lot of practice to get that self-advocacy of like, this is how my brain works. This is what I prefer. And then I'm actually going to stand up for it and say it and do it.
Advocating for your needs. It's accommodations. So, right? So like we talk about like accommodations for ADHD and autism for kids, but we never talk about what that looks like for adults.
That's so true. There's a lot of focus, even when I was like growing up, is right when the big ADHD, like all the kids were getting on medication.
Yes.
Like I don't know how old you are, but like
we're about the same age.
Okay, yeah. But like, a lot of the kids that I grew up with were on early ADHD medication, and they really don't talk about it for adults. Like, what does your life look like? How is it a little different?
Yes. And like, not just that, like there's so many, especially women, but so many people in general that get missed as kids, and then as adults,
because I'm like high perform, like
same.
There's the societal narrative that like ADHD people are kind of what was the other one? Inattentive. That's what it looks like.
Yes.
And so I'm high performing, successful, like good grades. That's not her. Well, but how about the fact that she hasn't taken a nap in 4 years? Like, I don't fucking know.
So some of that is like different types, but some of that's also gendered. So I've actually looked into this. Some of that's gendered, the gender expectations of women versus men, right? Women are expected to not cause too many problems, to be able to be social and be talkative. So if they're interrupting in class by talking, it's kind of like, oh, that's just a girl, right? Women are expected to like, not as many like excuses are made for women, right? Like, you know, like when they make excuses for a guy that does something wrong and they're like,
sure,
oh, he's just a young boy. You have to just let it go. You never hear somebody say that about a girl, right?
So
Yes. So like the society conditioning of like, we need to behave and we need to not cause problems kind of causes a lot of the symptoms to get masked or overlooked, or just like you compensate and you mask them to like try to just like not cause and problems and follow the rules. Yeah.
Wow.
It's like really wild.
Yeah.
So it's gendered. I mean, that's specific to the US because, you know, gender is expressed differently in different countries and stuff.
Sure. So back to autism and kink. You were sharing something about
sensory toolkits.
Yeah, oh yeah, we can go back to that. I was
which one do you want to go to?
But on one of our past calls about like the start of kink on the internet and autism and how it's connected.
Yes, I want to come back to the sensory toolkits.
Oh no, we can finish sensory toolkits.
Let's do this first. They're both good. They're both so good. So this part of like how kink and autism got so linked, like BDSM specifically, is really fascinating and is something I learned about for our webinar that I did. So basically, kink before the internet, before the 1990s, was just like people talking and networking and like getting to know each other and like finding their people. Yeah, like word of mouth.
IRL munches.
Yes. Yeah. And that was like kind of hard for a lot of people who might have wanted to be in it to get into, right?
Right. Like I'm like, my mind went to like, oh, Craigslist. No, there wasn't fucking Craigslist. Like what are people? Yeah.
Internet. Yes.
No field. No,
yes.
No fucking
none of it.
From field.
None of it.
Okay.
And so what happened was when the internet started, you think of the kind of person that would be involved in something that's as brainy and as hyperfixaty as the internet, right?
And coding, software development.
Yes. So on average, a man with autism, right? A lot of men with autism were responsible for, you know, formulating both the start of the internet and the start of internet culture. Because they were the ones like interested in it, right? And so that kind of formed a lot of like early internet talks about BDSM and kink. And so it's very interesting because like BDSM and kink kind of really blew up after the internet, like after the 90s, much more than they had before. And the way that it was structured was based on the way that the men with autism who were talking about it on the internet would want it to be structured. So the extensive consents, the talking about it before and after and making sure you did a good job, the sensory play, going back to the sensory toolkits, all of that. And so
fucking cool.
It's so cool.
It's so mind-blowing.
Because it's like, okay, like I never would have tied that together without like reading that. And you're like, oh yeah, makes so much sense. And then that's also like where I tied the sensory toolkits to BDSM because I was like, oh, of course, like people with autism notoriously don't like eye contact. So blindfolds, really good. Overwhelmed by senses, you could take senses away. Blindfolds, pressure with the restraints, gags. You don't have to talk, right? If talking makes you like,
or like I really like shibari, like being tied up and like feeling that safety.
The pressure. Remember what we? The pressure. Hot wax,
dude.
You know what I mean? Because
it's so cool.
It's all autism coded.
Very connected. Yeah,
it's all autism coded. Yeah.
So I asked my audience if they had any questions for you, and the one question was like, why are so many people online in the kink space is it neurotypical? Neurodivergent. Yes. Why are so many like kink influencers neurodivergent? And it's like, here we go. We're putting the pieces together.
I think also like neurodivergents already aren't fitting into an allistic society, right? So like what we talked about, the pressure to fit into an allistic society. The society is built for the standard.
Yes.
Okay. Which is a neurotypical. Okay. And so neurodivergents are already so used to not meeting societal norms that they're more likely to explore things. So they're more likely to be on the LGBTQ spectrum. They're more likely to be involved in BDSM or kink. And that is a lot due to already not fitting. So like being more willing to explore those things. Not necessarily that it's more prevalent in that population.
Right, because allistic people could want to be in those communities, but people that are neurodivergent are like more comfortable.
Yes, breaking the barriers.
Yeah. Damn.
Isn't that wild?
And also with the internet thing, like thinking about forums and like FetLife and like, I mean, a lot of forums, so Reddit, FetLife, all these places, like they still look the same as they did in the 90s because it was just like, let's have conversations and how can we dive deeper into these really specific subjects. And so it makes sense that that's like how these conversations about these niche taboo things would start.
That also goes into like diagnostic criteria for autism. Like one of them is like, do you get really upset at small changes? Like, do you need to take the same route to work or the same or do the same thing in the same orders, or if somebody makes one different turn, do you get like really stressed out and start to like melt down? And so like
it's like best the forum looks the fucking same 30 years later.
Yes. Yeah. Because they're like, oh my God, we can't mess with it. It's fine. It's working for us. Don't touch it.
And it truly has not changed.
Yes.
But like not because of that, but because it works. They create like something was built that truly works for like how to have structured conversations.
Yes. It works, but also, yes, they're afraid of change also. They're just like, yeah, no, this is fine. It's an MS-DOS. That's okay.
And like how things are structured with like subreddits on Reddit. Like, I don't know if you've ever poked around on like kink and BDSM and sex and porn Reddit, but holy shit, it is wild. Everything exists. Everything is out there.
Is it like 4chan?
It's like, it's even crazier than Twitter, what you can find.
So yeah,
but like very specific kinks you can find. Like,
so like 4chan from back in the, were you ever on 4chan back in the early 2000s?
I only know about it from conservative crazy bullshit. What's the I'm
alt-right and all that?
Yeah.
So it used to just be like a free-for-all. Like it was prior to Reddit, prior to everything.
But anything went, right?
Yes, like, anything went pretty much. And there was like black market stuff on it was just really wild. It was like when I was in college, some of the people I knew were like on 4chan and were like, look at this. And I was like, what in the world is going on here?
Yeah, I remember like in college you could like buy drugs online, like what was it called? Something marked Silk Road. Like I don't know.
Yes, I heard of that, but like I was so sheltered and so scared of everything. I was not buying drugs on the internet.
Yeah, no.
I was.
She's never bought drugs ever. She's a professional.
Yes, no, highly illegal.
Okay, so people on the spectrum had a huge part in creating the internet.
Yes,
and involved in that was sex and kink and BDSM. Aside from that, one of the things that stuck out was just like what you already touched on, which is like the sensory element and how soothing and amazing it can be. And looking at kink, and I'm like, oh, all of the modalities that are practiced in kink and BDSM create that sensory experience. For me personally, what I really like is what a lot of those implements and modalities do in terms of making me feel present for ADHD. So I find that like I really struggle being present during sex, especially with a new partner. But if there is a lot going on, which is great for an ADHD person, I feel very like present. And also plays into power dynamics. So
there's enough like stimulus.
Yes.
To like
actually make me calm almost in a way.
Well, it's like so funny because like one of the weird ADHD symptoms that I had when I was younger that didn't click with me till I got diagnosed was I would sit in lectures, like especially like middle school, high school when you had to sit for longer lectures, college, and I would fall asleep. It would be like a bet when I was in college. And like it worked its way into like if I had to go to talks and stuff and people would be like, LOL, so funny. Or I'd be like with a crossword to keep me like to keep enough stimulus. And people would be like, are you paying attention? This is rude. And I'm like, no, otherwise I'm going to fall asleep, which is also rude. And they're like, that's not a thing. But like for me, it really is. I'm just so bored. And it doesn't matter how much caffeine I had or how much rest I had. I'm just so bored. I'm just going to pass out.
Wow. Yeah. I mean, you're making me think a lot about how not designed school and college is for neurodivergent people.
Yes.
I went to a very alternative, hippie 1st through 5th grade school that was amazing. We went camping, we did group projects. It was like ADHD dream. But then when I went to a conservative like 9 to 5 whatever school where I was sitting down classroom learning from textbook, that was after I went to the happy fun hippie school, and I was like I had my mom take me out. It didn't make sense to me. It didn't compute to sit down as a child and like learn and look at textbooks all day. And I mean, in my mind, they're just preparing you to try to work a 9 to 5, which is also like the general thing. Like, let's get the majority of neurotypical people to go work normal jobs.
Yes.
And then there's this pretty big majority of kids that are just like really struggling in those environments.
And a lot of people don't process learning auditory. So you're doing a lot of auditory stuff, right?
Yeah,
so like I'm somebody that I'm not an auditory learner. I like to teach myself. I can read. I can like, I can draw it out, whatever. But like I need to do it myself. So when I did grad school, my clinicals were in person live with patients, but my coursework was all online. And they had recorded lectures that I never listened to. I just would do the PowerPoints, do the reading, teach myself. And I thrived. It was the like it was the best I'd done in school in a long time, partially because I really wanted to be there and it was really like my special interest to a degree, right? And then partially because like I was able to tailor it to my learning style.
Right. Yeah. It's really tricky. So what other patterns or themes do you see for people on the spectrum relating to sex or sexuality?
So I think impulsivity with it can be a really big thing, wanting that instant gratification, that dopamine hit. With people with autism specifically too, we actually see a lot more victimization, a lot more instances of sexual assault and rape because of that hard time reading the social cues.
Okay.
Because if you can't read a social cue, you might not know that a situation's dangerous to be able to get yourself out.
Wow.
And then statistics on sexual violence are always like, once you've been victimized once, you're way more likely to be victimized multiple times.
Oh, interesting.
Yeah. So like, and like allistic people can sense when somebody doesn't know the social cues. The social cues. So you like, they like can prey upon people with autism or ADHD who maybe don't understand them and be like, oh, this is an easy target.
Wow. Aww.
Right? Because they can like sense it.
Yeah.
I would say that's another like really scary, sad thing.
Definitely. Yeah, ever since my ADHD diagnosis, I realized my life is a long series of trying to get dopamine hits and the constant battling with my mental health providers and support system to find like a gray area, which is really difficult. I find myself being a very black and white thinker and personally struggle with like having a lot of casual partners. And then once one thing starts to get serious, being like, ooh, I got a little attached to the dopamine of the newness of new partners. And so, trying to figure out down the line what a serious relationship looks like for me, because I'm probably still going to want some of that fun, sexy dopamine sometimes. I don't know.
There's also the like what your upbringing says about your sexual relationships as well, right? So your romantic relationships. So if you have a traumatic upbringing, you get conditioned that chaos is normal.
Yeah.
That's normal. And calm is weird. Okay?
Calm is weird.
I don't know
how to
not
chill.
right. It's
I'm trying
uncomfortable.
to learn how to rest.
Exactly.
At the moment.
So the ADHD plus any kind of trauma that you may or may not have, it kind of plays into, if you get into a stable relationship, it feels wrong. It feels uncomfortable. It
feels boring.
Yes.
It feels fucking boring.
So you might find yourself picking fights. That's something ADHD people do.
Oh, God.
Picking fights, like over nothing, just to like feel something. Not for any reason you're not unhappy.
Or like, let's get the stronger flogger because like just feel something regardless.
Just trying to cause chaos. Just like, let's break it. Like,
fuck, man.
Yeah, because you're just like sitting at a level, like it sounds good and it's what you're supposed to want, but how do you know how to deal with that and accept it and trust it when you've never felt that before?
Right. And it's also we deeply crave is peace and like a relationship that actually feels really safe. So I think that some of my seeking of new dopamine and sexual experiences is to like not connect with the trauma, but like, have an exciting, unpredictable experience.
Well, taking control of it. So like sexual trauma, when we talk about it, a lot of people think sexual trauma victims go sex negative. Some of them do. Okay.
What do you mean sex negative?
They don't want to have sex with very many people. They want to they want to kind of build trust, whatever. But some people go far.
Not us.
They go the other direction to take control, like what you're saying, to take control of the narrative. Like, okay, I'm going to have all these crazy sexual experiences on my terms.
Yeah.
To take control of it because it's on my terms. Yes.
Yeah, it can be powerful.
Yes.
And a theme I see talking about kink and BDSM is like revisiting certain like having a negotiation, consent discussions, and then entering a space that could be somehow tied to a past trauma, but doing it in a safe, controlled environment and like actually healing that experience.
Absolutely. I think it can be very like good as long as you have like a safe partner and you are in a place to process those things. I think sometimes what I experience on the therapist end is people want to process something they're not ready to process. So like if your every day-to-day life is so chaotic and you want to bring in this old trauma and bring it back to the surface, you're not in a place to handle it because your everyday life is still chaotic as a result of this past stuff. So let's get your everyday life under control, because bringing that trauma to the surface, talking about it, trying to unravel it is inevitably going to cause some chaos personally. Yeah. So like, you're not ready for more personal chaos. You're already having too much.
And best to bring in professional psychiatric support for such things as well.
Yes.
Yeah. And I think to revise that, like, for me, the healing experiences I've had with kink, it's been from things that I've already done a lot of work on in therapy.
Oh, okay, good.
But it can be really healing.
Yeah.
And something I've been talking a lot about lately is like the importance of the trust element. Because I was having like more kind of random casual hookups and sex with people where there wasn't that trust. And I was like, you're a dom, I'm a sub. And it's like, that's actually really vulnerable to give to somebody. And you can actually end up in these altered states, like subspace. And so it's safety is really important for anybody that's new. And just building, like, not safety, well, it is important, but trust is extremely important, because like, you are in this vulnerable, altered state sometimes, and the wrong person could take advantage of that.
Yes, it's the same kind of thing. And then like, it's the same, it's like the thing where some people who are inexperienced in that community, they'll just like be like, call me this, I'm calling you this. And it's like, titles are supposed to be earned for a reason, not because not because it's this big like crown for you to wear, but because it's indicative of a trust.
Yes, right? Titles, so, like, that's an important PSA that I haven't really directly shared, is that titles, meaning mommy, daddy, good girl, like those kind of things that we see and hear about, those totally come with trust.
Yes.
Yeah. And inexperience, like no shade to the people on Field or these dating apps where they just slide in being like, hey, what's up, daddy or mommy or whatever. Like, it's just like, I find I have to do a lot of education because I've been in this world a while, and I'm like, I don't really have the capacity to educate anymore.
Well, you're doing this. This is
Listen to my fucking podcast.
You're like, here's my link.
I'll like unmatch with people on Field if they
so you
call
should podcast bro them. You really should send them your link.
I do. Or if like or like another title is like, or not title, but like a phrase would be like, you're such a dirty slut or whatever. Like, that stuff will come out really fast. And I'm like, no, here's my podcast. Unmatched.
See, not enough consent, not enough trust, not enough everything, right?
Right. And part of that is like, does this make you feel okay? Or doesn't make you feel truly degraded, you know?
Yes.
And so, a lot of conversation has to happen first.
Absolutely. Well, titles, just like any relationship, are earned. Friendship is earned. Boyfriend, girlfriend is earned. Husband, wife is earned, right? And so people are thinking of this like, BDSM is not a casual sex thing.
No. Well,
not overall.
When two experienced people come together, it can
overall,
be. But
but overall.
Yeah, overall.
It's not meant to be.
It's like some pro shit.
Yes, it's not meant to be that. It's meant to like be a time thing, a time commitment on learning, a time commitment on trust building. But as a whole, it's not meant to be like a casual one-off, one-night stand kind of thing.
No.
So when you're casual, the one time you meet, someone's like, call me this, do this, submit to me. It's like, whoa.
Yes.
Like, it's not.
Yeah. I mean, I have a sub, and we play like once a week. And it took me like 4 or 5 months of us playing together to peg him, which was so fun.
Oh my God.
But like, it took that many months of like trust, him expressing his desire, me being like, how do I feel about putting a dick on? Like, it was a process, and it takes so much time. But then in the movies or porn, we just see the act and the hot steamy shit, and we don't see the trust, the consent, the talks, or in this case, months of a relationship building.
Well, I think one of the things that's complicated about that too is like, when we look at porn, there's a lot cut. Breaks are cut. Prep is cut. They're not talking about like the 24 hours of
they're on
prep.
set for fucking 8 hours.
Yes, and the prep that they're doing a day before of like fasting and taking laxatives or wearing plugs or doing whatever they're doing to get their body ready for this.
Oh, we're talking about anal.
About any of it.
I know, that's just funny.
Yes, but like, well, you're talking about pegging. So I know. You know what I mean? So like, people are just like, yeah, peg me. And it's like, whoa. Like, there's a whole lot more. But when they see it on film, that's what they think is going on.
Yeah, and no shade to anyone for having perceptions of what sex looks like because they've been conditioned to watch porn, but it's like there's a lot of unlearning that has to be done. And what I've realized that with men specifically is, and I've done some polls on my page, but men are often exposed to porn as under 10. I mean, very young is when they start watching it and consuming porn. I didn't watch porn until I was 19 for the first time, and that's very common with women. And so men or boys at such a young age are watching this, and that's what they think sex is going to be like. And then men also often struggle to like get or maintain erections, and it's like, well, you've been masturbating since you were a kid, watching super hardcore shit, and then you're trying to have sex, and it's nothing.
Just like regular vanilla sex for the first time kind of thing.
Yes.
Absolutely. I think it also, like, it's really sad because it really skews...
Big time.
...the perception of connection and what sex is supposed to be and, like, all of that. Like, not that sex with any violent component can't be connective. It can be. But it doesn't come off that way a lot of times when people are watching these kind of scenes, even if for the people involved it was. You know, even if it was done well. But, I mean, there's a lot of porn that's not done well. That's not, you know... done in a way where the connection and the safety of everybody emotionally is important. And
I see, because I like to watch porn with self-pleasure, but I see it as very different than sex. You know, like it's not, they're these two very different things for me, like connection and intimacy and touch, and then like the sexual experience that I have with a partner. And I absolutely don't expect it to look like this crazy, filthy shit that I'm watching. Like
well, I think it's like based on trust.
Yeah.
It's based on trust. Like anybody who's had sex will tell you like there's a difference between like making love and fucking someone. And I mean, in the same situation, you can make love and fuck someone in the same session.
Yeah.
But it's two different vibes.
It is a different vibe.
It's two different vibes.
We got to be doing more vibe checks, you guys.
It's two different vibes. Yeah. What are the vibe checks?
Yeah.
Where are we both at?
Yeah.
Yeah.
Yeah, I love talking about neurospicy stuff.
It's so wild how all of this is connected and how taboo it is. I think one of the things on your podcast I was really interested in was the girl you had on who has the largest database of all the kinks. Yeah. And she was saying she was running into all kinds of problems trying to do research because no one wanted to touch it.
Yep.
And I think that is a huge problem.
Yes.
Nobody wanting to touch sex. Patients come to us with sex problems, like side effects of meds cause sex problems or just sex problems in general causing mental health problems. Like we have to be prepared to answer some of those tough questions.
Right.
Like, and not just from someone you're comfortable talking to, like a woman about your age, but like older people or middle-aged men or like, you know what I mean? You have to be ready to be like, okay, like what does this look for? What is your comfort level? What are you looking for from me? Because sex, having sex, whether it's just whatever that looks like for you, is part of mental health. People want to be touched.
Yes.
People want to be touched. Like one of the things I took from a long-term mental health patient, she was in bed. She like ran pretty dramatic, but this was one of the more touching things that stuck with me over the years. She was laying there crying one day and we're like, what's wrong? And we go back there and she's like, I just want to be loved and touched and fucked just like everybody else. And it like, you know, and she knew that like she was different and that wasn't really going to happen for her in the same way. Yeah. And she was just like so hysterical over it. And I was like, we all just want the same things.
And we want not necessarily even sex, but the oxytocin that's released, right? After a certain amount of human touch. I mean, I was getting my nails done a couple days ago and I was like, I got like a 15-minute massage on my neck and shoulder. I was just like, I just need something, man.
Well, like cuddle cafes are a big thing like in Asia and stuff. Yeah. Because like people just like, it's not even like sex.
I think about this almost every night because I'm like, I would like an attractive man to just be laying here. Just cuddle me. I'll big spoon you. Like just like, but like I would pay somebody to fucking cuddle me.
Yeah.
I don't know.
There should be a cuddle app. You could probably get someone.
People could probably pay me.
Yes, you could probably get someone to pay you and cuddle you.
I mean, maybe sometimes I do.
That's amazing.
He's on a trip right now, but I just recently acquired a service sub who gets off on cleaning my house and doing my chores.
I love that for you.
I don't have any expectations
so you
to
can
do
sit
anything
just
sexual.
Like, you can just sit there and file your nails.
Yeah.
I love that.
Fucking great.
That's amazing.
Matriarchy shit.
I need someone to do my laundry.
It's a lot.
It's the worst. It's so many steps.
A lot lately of how hard it is, probably extra hard for ADHD people, to do all of the tasks that two people are supposed to do. Like a couple is supposed to divide and conquer. And I have like a small zoo of animals too. It's just like a lot. It's just a lot, man, to do all this on our own.
It's also like, it's the number of steps that each task is.
Yes.
So like, especially for people with ADHD, you'll go into like, executive dysfunction, like paralysis. Okay. You'll make a list. Okay. But then you're trying to rate the list of what's most important to do. That alone can like screw an ADHD person out of a whole 2 days, not even a day. Okay. So I always tell people, like, make a list at the beginning of the week. Don't rate it. Tell yourself you're going to do one thing each day.
Somebody did just tell me, a mentor of mine just mentioned, put how long you think the task is going to take next to it. And that's been really helpful for me because I've been like, the 5-minute fucking thing I've been putting off for a month.
Yes.
So that's been kind of
that can be helpful
hack.
too. Yeah. And then breaking things down into steps, like the number of steps that it'll be. Like,
yeah, but then that's too many. That's a lot of steps to do, and sometimes that'll be the overwhelm.
Sometimes, but some people find it helpful. They can break it into like manageable chunks. But also, sometimes it's helpful for perspective of just like, why am I so overwhelmed by X task? So like for me, my ADHD hates laundry. I am like a 13-year-old girl when it comes to laundry. It is terrible. It is. It is out of control. So, like, it's the number of steps. You've got to gather all your laundry. Then you've got to sort it. Then you've got to wash it. Then you've got to dry it. Some things need hang dried. So, in between washing and drying, you need to take them out if they're, like, sensitive fabrics. Then you need to fold them. Then you need to put them away. Why? It's too many steps.
No. Have a man who gets off on that do it for you. Oh my gosh. I do my laundry like a teenage boy. I do none of those things. I throw it all in the washer.
Oh my gosh.
I know.
Oh
no. I throw it all in the washer, all in the dryer, and see what happens.
Do you put it away?
Yeah.
See, I a lot of times get frozen at the putting away.
Same. I put it in a pile sometimes. Then I'll rewash stuff so it doesn't have wrinkles.
Yeah, or put it on the dryer cycle, like wrinkle release or something.
I don't know if it was you or someone else. I was telling someone how, as a child, I would make all of these lists for myself. And somebody was like, that's like got a little tism energy. Like literally my journals at night were lists.
That's very tismy. I really liked Venn diagrams when I was a kid for decisions. I really loved a Venn diagram.
Pro-con lists, baby.
Oh, yeah. But like specifically, I liked the visual of the two circles and like what's in common of these two things and what are the pros and what are the cons and like.
They should put all the ADHD kids together. Maybe they do. I don't know if they send them off, but like we would the cool thing is like I feel like a lot of successful entrepreneurs specifically have ADHD because we have really high risk, like we're really down to take crazy fucking risks. And some of those risks used to ruin my life and cost me tens of thousands of dollars. But like now that I've like toned it down on the risk taking, I'm willing to do the things that nobody else would do.
Yes.
But that being said, like I wish we all could have been fucking friends as kids because, well, women often aren't diagnosed. But if we'd been fucking friends, we would have been handling some shit.
As adults, a lot of times people do find each other, though. You find that you kind of like, they kind of glob together because they're like, oh, you see the world I do. I don't have to explain it to you. Thank God, pressure off. Right.
Well, and we can just like roll with each other, just like even in this conversation, and we move at a very fast pace and we can keep up with each other. And so I find that romantically, like I also want some type of ADHD partner. I had someone recently, like a guy I was seeing, he like asked me, he's like, so are you on ADHD medication? And I felt a little like it was a little bit like, you're kind of fucking nuts. I don't know. But I'm like, I like ADHD partners because we can like
same.
I don't know, flow the same way, move at a fast pace.
Well, my current boyfriend, he has autism and ADHD, and so it's really fun because like we can hyperfixate on things, or we can have these like
really the hobbies,
the
TV shows.
Yes. So we can hyperfixate on things and like be in public hyperfixating on things. And a couple times we've caught people looking at us and we're like, don't look at us. So
we're just really focused.
We're just really focused on our thing. Like we're really focused on Trivial Pursuit cards right now. We like take them everywhere. We're not playing Trivial Pursuit. We're just like reading them at each other and quizzing each other. Oh yeah.
Yeah, that's
like us in a Chili's with a stack of Trivial Pursuit cards.
That's adorable.
It's so fun. But I'm like, who else would find this to be fun?
Right.
Probably nobody.
Yep.
Just us. Just two little ADHD weirdos, right? And so, but it's great. It's so like, because you have your person that can like match your need for like all of that.
Yes, definitely.
Yeah.
So I don't know. I don't have a sex question queued up, but I feel like we should talk about sex a little bit more.
Okay. Well,
I mean, like maybe let's go back into a little bit of common themes with autism and sex or ADHD.
I mean, we can even go into the BPD stuff that we had talked about. Do you want to do that?
Yes, please.
Okay. So in prepping for this, we had talked a little bit about like borderline personality disorder and sex. Borderline personality disorder, I'm going to refer to it as BPD.
Okay.
I just want to like clarify that because sometimes people get it mixed up with bipolar disorder.
Yes.
So
I've been confused by this.
Yeah. So I'm like,
is bipolar disorder abbreviated to the same? No.
Bipolar disorder is bipolar disorder.
Not
or
abbreviated.
It's just bipolar.
Okay.
Like BPD is borderline personality disorder.
Okay.
Pretty standard across things. Sometimes you'll hear people use an outdated term called axis 2. There used to be like 5 axes of like psychiatric disorders, and axis 2 was personality disorders.
Gotcha.
So narcissistic personality disorders in there, borderline personality disorder, histrionic, there's like a handful of them, obsessive compulsive personality disorder, they're all there. But so sometimes people will say axis 2 as well, but given that that's outdated and it means more than one thing, I don't tend to use it. I think it's a really important conversation to bring up because there's overlap with BPD and autism some.
Okay.
And also there's a lot of overlap with sexual trauma, which we were talking about, and BPD and autism. Yeah. And so borderline personality disorder, for those who are not familiar, it's basically an inability to self-soothe. Okay. So a lot of times you have unmet childhood needs. Sometimes childhood abuse, 60% or more of the time childhood sexual abuse.
Oh, wow.
Yes. But sometimes just unmet childhood needs.
Yeah.
And not being taught how to ask for what you need and just kind of becoming chaotic to get what you need done.
Wow.
And it gets this terrible reputation as attention seeking.
I want to interrupt you for a sec and talk about my perception of borderline personality disorder having really no context or education until I ended up on more like mental health TikTok scrolling, because there's actually a lot of really incredible creators that talk about ADHD, OCD, borderline personality disorder on TikTok. And it wasn't until I went on this little deep dive of borderline personality disorder on TikTok where I was like, this is not what I thought it was. Like societally, I just had made up that it was kind of, it was like a personality disorder where like a person, generally like a woman, was just kind of fucking crazy or like deceptive or like these really big, intense negative associations. And I don't know where that came from.
It came from society. It also came from some mental health professionals. Like, I will say this disorder is like so stigmatized.
Yeah.
Men are underdiagnosed, women are overdiagnosed. BPD and bipolar have a lot of overlap. The big thing with bipolar is a lot of the symptoms are tied to sleep. Okay. But that doesn't occur in BPD.
Okay. Well, with bipolar, it's like mania and
depression.
Okay.
Yes. But with BPD also, there's like one criteria that I find that patients with BPD resonate with that like no one else really does. And you can see like a visceral reaction. Like, it's kind of sad, but also like reassuring to me.
What are you going to hit me with?
Excuse me.
Because I think I know what it is.
The question that you ask is,
if you are watching or listening to this, you're probably interested in sex and or kink and are curious about finding new partners to explore things with. However, it can be difficult to find those people. The thing I love about the HUD app is that it's more than just an app. They have a community, a podcast, and a ton of education. And inside of their app is a bedroom feature, so you can select all of the things you're interested in, all of the things you want to try, all of the things you don't want to try, and that can be shown to potential future partners. So to learn more, go to hudapp.com/sextalk. That is hudapp.com/sextalk, SEGGSTALK. I was recently giving a blowjob to a partner, and one of the things that I love incorporating into all types of play is lube. But specifically with blowjobs, I love being able to use this honeydew flavor of mochi melt because it makes it so much more fun and delicious for both parties. I also enjoy using it for penetrative sex, and in the past, I found that I can't really use flavored lube down there because it could upset my pH. However, mochi melt is pH balanced, it is food grade, and it is FDA approved, which makes it completely safe for use down there for the ladies and the fellas. If you want to try out mochi melt, go to mochimelt.com and use code THEA, THEA, for 15% off of your entire order. Mommy Thea recently created a profile on sensually.com, which is a sex-positive platform for people to both provide and seek out sex-positive and sensual experiences, which can take place both online and in person. They have a wide variety of creators on their platform, ranging from BDSM experts to sex coaches to escorts to erotic artists. They have it all. It is completely free to sign up, whether you want to create an account or seek out experiences. You can learn more by going to sensually.com. That is sensuali.com.
Do you nearly always feel empty or scooped out?
Oh. No, I don't.
No, you don't. Okay. So it's not you. Okay, good. So, but I mean,
thought something else is coming, which I'll share in a moment.
It's like a visceral kind of thing for them. It's like really sad.
It is sad.
And so like you bring it up to them and they'll also have the same perception of like, well, I'm not manipulative. I'm not a bad person. Like, what are you talking about? And I'll be like, I don't think you are.
The movies made you feel like that's what that disorder is.
How to self-soothe. And so this is good, though. We can help you. There's also a misnomer that we can't do anything for people with BPD.
Okay.
There's no medication that has an indication, like an FDA use for BPD.
Okay.
But there are medications that can help with the impulsivity, medications that can help with some of the agitation and stuff, that can help with the symptoms. And the main treatment is therapy, teaching people these skills they didn't learn as a child.
Yeah.
So they can self-soothe.
Yeah.
And like, it's really sad to me how many of patients I have with BPD that either have been misdiagnosed in the past, not diagnosed, or have been told by providers even, there's nothing I can do for you. You're just stuck. And that's not true.
Wow.
Patients can go into remission from criteria. They can stop meeting criteria eventually. They can age out of criteria. A lot of women in their 40s who have BPD, like it kind of just like tapers off with age a little bit.
Okay.
And so it's like very interesting, but BPD ties into sex really heavily, partially because of the sexual trauma, but partially also because of when we think of like childhood sexual trauma, okay, what that teaches you is that what you have to contribute is sex, and that's all you have to contribute, okay? So they struggle a lot in relationships if they're not having sex like all the time.
Because their worth is tied to being hypersexual.
So they're like, well, I'm not a good partner. They don't love me because I'm not having enough sex with them. And this huge pressure to have sex, or this huge pressure of like, I have to do this, or what is my meaning? What is my purpose? And also self-soothing with sex.
Sure.
Because we're saying like, you don't know how to self-soothe, right? And so like just finding this malcoping of like, oh, okay, like this is a way I can connect with somebody.
Right.
Then maybe somebody will love me. Right. And it's really, really sad. And it's like, okay, we need to look at our motivations when we're trying to have sex and say like, hey, are we having sex because we want to have sex, which A+, or are we having sex because like there's another need that we need to address? Maybe we need to address that first. And then, then we can talk about it.
I've been doing a lot of reflection on that lately personally, because I had a very exciting, fun first year where I started learning about power dynamics, exploring them, exploring kink, going on a lot of dates on field. And it's been in the last few months where I've just been like, it's kind of like they talk about this in AA, like hungry, angry, lonely, tired.
Yes.
And probably in
halt.
Halt. So like, okay, I'm thinking about drinking, or I'm thinking about fucking this random guy. Am I hungry, angry, lonely? Often it's lonely. Often it's like this evening, I've stopped my work, and it's like this kind of boredom. And what I've really been working on my therapist with is like, how can I fill this with something that feels kind of busy, but that is not fucking work. That is not the podcast. That is not this thing. So like, I got really into embroidery during the pandemic, or like color books. Like I have an erotic color book. Like what is a way that I can be busy, but that's not going to try to find something to fill the spaciousness or this time. And for me, my go-to used to be alcohol, but now it can often be like a guy or food, like going and getting like a pint of ice cream. And so what's important about this work and this shit is just becoming aware of it. You don't need to fix it all in a night, but now I'm becoming aware of this spaciousness in the evenings and my desire to fill it with dopamine. So yeah.
Yeah, I think it's like this natural desire of a lot of people, especially people with trauma who've been taught like, oh, okay, if I'm calm, then the situation will be calm. So trying to push down any negative emotions rather than address them. Okay.
Yeah.
So going back to like unmet unmet needs, right? Whether you have BPD or not, having unmet childhood needs.
Right.
And
totally.
So like trying to teach ourselves, like treat ourselves like a child. Like what would you offer child self you? What would you offer child? What sounds good to you?
Right.
Right. And so kind of thinking about that. So it's not just like staying busy. It's like getting something fulfilling out of it. Like embroidery can be fulfilling and all of that. And like versus
it needs
just
to be
like
a positive
distraction.
loop somehow. Right.
Yes.
It needs to be a positive loop. Otherwise you'll end up back with the comfort food or fuck.
Yes. Because you're just, because you're distracting. You didn't address that need. You left it unaddressed. You just out busied it, but it's still there.
Right.
And like that's something that I work on with people with trauma a lot is co-occurring timelines. Okay. So when you get into a space where you have PTSD flashbacks, or when you're having a borderline dissociative episode, like borderline personality disorder is notorious for dissociation.
What is that? What does a dissociative episode look like?
So just like kind of having like I would describe it kind of from what the patients tell me, like a spiral of chaos. A lot of times like they might hear one thing they don't like. People are all good or all bad. Now this person's evil. Now they should kill themselves. Whoa. You know what I mean? Like it can just go from 0 to 100, like kind of in a minute.
Yeah.
And then it's so chaotic. They
hard
forget
to get out of that spiral.
Yes. They don't even remember what the original need was.
Yeah.
And part of this is that like co-occurring timelines of like unmet childhood needs. So there's the problem in front of you. But then there's the underlying current of what your unmet childhood need is and how it's affecting the problem in front of you. And you've kind of shoved childhood you and all of those problems into a box. And you've been like, calm down, it's fine. And ignored them the same way you might have been ignored as a child. And so now in this situation, childhood you has gotten so out of control because not only were you ignored as a child, your adult you is ignoring you. So they're going to rage until they get attention because they've tried to ask nicely. And so that can lead to a lot of these big impulse episodes or whatever because that childhood you is now like, I'm going to throw a fit.
Yes.
It's a tantrum. I'm going to throw a fit.
Yes. No, I mean, my childhood trauma is directly related to literally door and face closed, ignored, anger, not able to process emotions, and then pretending like everything was fine the next day. So for me, learning that my emotions are okay, that anger is okay. Because what I started noticing was a pattern of like anger, rage, emotion, or like actually advocating for my needs to somebody in an assertive way, and then instantly going into like shame and like wrongness. And so, yeah, man, childhood trauma's a bitch.
It really is. I mean, and that's
It doesn't go anywhere until you address it either.
It certainly does not. You can run, but you can't hide.
Yeah.
I think a lot of people with childhood trauma too, they like try to move away from where that trauma happened. They're like, it'll be different in a new city. But you know, the phrase, wherever you go, there you are.
Yeah. Yes. Yeah. I tried that one in my 20s, internationally traveling. And then I was like, still me.
It's like, oh man, that didn't fix it?
Yeah.
Dang.
Yeah. I want to go back to, I was doing a little fucking TikTok. TikTok knew I had ADHD before I did. It ended up on my feed. But then BPD ended up on my feed. And I was like, oh, fuck. But I don't know if I have it or not. But there was one symptom when I was investigating it, which was like a bit of like rejection sensitivity stuff.
That can occur with ADHD too.
Yeah. I think that's what it was. It was kind of like, or one of the indicators of BPD was like, in a relationship, you're pretty stable. Like there's a stability. Okay, maybe not.
BPD, it's usually less stable in a relationship.
Maybe it's AD. I don't know. Something I was researching was like dating and new romantic interests can like put you in a freak out mode, which I often find myself in. I'm just like wanting it to be chill, but like the fixating on like they haven't texted me back. What does it mean? What is it all?
Yes.
Like,
well, because it's that like one of the criteria for BPD is asking like about like fear of abandonment. Like, do you have a chronic fear of abandonment or a chronic fear that like even when you're in a relationship that someone's going to abandon you even when there's no threat of abandonment?
Wow.
And for some people, the word abandonment doesn't resonate, but you think about like it can be rephrased to like a fear of not being deserving of love.
Oh, and what I'm gathering too, talking about BPD with you is like, I think because it's so misunderstood and so many people don't know about like what it really is or the criteria really are. It's put as this like chaotic thing and this like like a diagnosis that you're born with. Whereas like a lot of what you're sharing, I'm like, this is something that comes from trauma and abandonment sometimes.
Well, you think it's both. It's nature and nurture. There's genetic components. So I think for a long time I was also under the assumption that it was all nurture, but it's both. There's genetic components, and then there's also how you're raised. If you're raised by somebody with a personality disorder, you're more likely to have a personality disorder yourself, because you're learning what's normal for emotional regulation from an abnormal source.
Yeah. Yes.
It's heavy.
How can someone with autism or ADHD, well, let's maybe break them up because I think the answers will be different. How can somebody with autism maybe advocate an approach for sex in a way that feels good and safe for them?
I think even if they're not involved in BDSM, following that same kind of formula.
Okay.
Even if that doesn't appeal to them, that's not the flavor of sex they want.
Sure.
Talking about it ahead of time with clothes on. Outside of the bedroom, right? Because like that's a big part of BDSM is like not in the bedroom.
Correct.
In a neutral space, you talk about things with clothes on at a good distance, saying like, hey, today I was thinking we do X. How do you feel about that? I'm not in the mood for X, but Y and Z are on the table. And kind of like talking through that before you engage. And then checking in throughout, is this good for you? Are you enjoying yourself?
No matter what.
Yes, during the process.
It doesn't make it unsexy. It doesn't make it unhot to check in and ask. You can also do it in a sexy way.
Is this what you wanted? Yeah. Is this giving you what you need? Like those kind of things. And then at the end, making sure aftercare is present. I think that that's something BDSM does very well that mainstream sex doesn't. Which is aftercare. Everybody needs aftercare. It's what
pillow talk is, like it's
exactly. Well, sex is very connective, and then it's over quite suddenly.
And vulnerable.
Yes.
Yeah.
And then it's over suddenly, and then it's like, okay, scatter.
Right. See you later.
Yeah. And it's like, that feels like very yucky. And so it's like making sure there's some sort of connective activity, but you can even talk about that in the ahead of time discussion. What do you like for aftercare? Because aftercare looks different for everybody.
Yeah. Truly.
Yes.
I mean, and I've said this before, like some people's aftercare is like, I'm ready to go process this on my own, especially maybe somebody that's neurospicy. Like maybe I am ready to leave if you're comfortable with that kind of thing.
But having the conversation people don't take it personally.
And feel abandoned. My aftercare is actually, because of my fear of abandonment, my aftercare is that you text me the next day every time. So my sub's homework is to always text me the next day and tell me what he liked, what he had a good time, like that kind of thing.
Nice.
I need the little validation.
Asking for your reassurance. I love that. Yeah.
So that's for autism. So what would you recommend, and maybe this is advice I like for myself, for somebody with ADHD who loves dopamine and has arousal tied to the newness of an experience? How can I approach sex in a healthy way?
I think especially when you're talking like with a new partner, talking about things you want to try, things each of you has tried. Because even that conversation can be exciting for someone with ADHD.
Definitely.
What have you tried? What have I tried? Like just like sharing the chaos, right? So having those kind of conversations, and also saying like, what haven't I tried but I'm interested in? Are you interested in that too? And maybe not doing all of those things that day, but like making plans to do those things in the future. Of like, oh, okay, like maybe we can go to a store. Like, and pick things out together to do X, or order things online together, read reviews, do whatever. Like that can be very connective and exciting.
Like make some of the anticipation of a shared activity,
of a shared new experience.
Fun.
Yes. And that can be like a shared, like rah, like, like, cause you get the dopamine multiple times. You get the dopamine from like, yes, we agreed to do this. Yes, we're looking this up. Yes, it's on its way. Yes, we're doing it. So it's like,
I'm dead.
It's multiple hits of dopamine on the same activity versus one. And so I think that can be really exciting. And then just like, having those conversations about all of the, all the things. Or maybe you've tried something, your partner hasn't, they're interested in it, and you're like, I can guide you.
Well, and I think it's important because like that's what I want next is like a long-term and kinky relationship. And so it's like, how can I keep it exciting in that experience with somebody?
Yes.
Yeah. When a lot of my sexual exploration has been tied to like short relationships, one night stands, like that kind of thing. So
and that can be scary too.
It is scary.
Sex is so important to long-term relationships. There's this, there's the long-running narrative that can run true for a lot of people that, sex dies in a relationship long-term, whatever. But a lot of times when you talk to people who are experienced in mental health, they say like it's tied to a bigger problem in your relationship.
Sure.
Because if your relationship's going good, you want to connect with someone physically. You know what I mean? So like maybe some other unmet need on one or both ends that's causing you guys to be disconnected sexually. It's not just sex dies. So it's putting those efforts in long term.
Definitely.
Right? But yeah, the newness too. Everybody likes new things.
That's great advice. And that's where now having been in this world long enough, I'm like, I don't know if long-term monogamy, multiple decades, I don't think it's for me. So like I'm getting clear on that as well.
I think that's important. I mean, it's important that you know that for you and that you know that for a partner going in so that like everybody can be on the same page.
Yes, definitely.
I mean, because what good are you as a partner if you go in dishonestly with yourself, not just with them, but with yourself about what you need?
Yeah. Yeah. No, those are great pieces of advice.
Yeah.
Thank you so much.
Oh, you're so welcome.
Well, thank you for coming on Sex Talk Radio, my dear.
Thank you for having me.
I appreciate the wisdom. And I think it's really important to be talking to academics and professionals just as much as I'm talking to sex workers. Like that's really my intention to kind of go back and forth between those two, because it's important to talk about our experiences, but then also talk about the whys and understanding. And I've always been really curious about the whys.
Yeah. I hope this encourages some people to like be able to talk to their professionals about these issues. I think a lot of times people are really embarrassed to bring them to their therapist or to their even psych med provider.
Sure.
And it's important conversations to have and to know that like we're here, most of us are here and most of us are open to hearing about it. And if they're not, maybe it's the wrong fit of provider, not necessarily the provider is bad, but maybe it's the wrong fit of them if you can't talk about what you need to get the total care you need. Yeah.
And then on like Psychology Today or searching for therapists, searching for providers, there's like a sex positive button, I think, or something.
Interesting.
You can get pretty selective, or like, so for on Psychology Today, which is where I've always found therapists, you can search like kink in the search bar and it would pop up with anybody that has that mentioned in their bio, which somewhere like Austin, there's a lot of kink and sex positive providers, non-monogamy focused, a lot of that stuff. And so, because it is a big part of my life.
I was going to say Ohio. I don't know. People would be hard pressed.
No. So not sure about Ohio, but here you can search the word kink, and providers that talk about kink in their bio, which is surprisingly a lot of them, do exist. So yeah, if you're facing any judgment as a patient, please get away.
If you feel judged, it's an unsafe situation for you. You shouldn't feel like that.
Totally. Yeah. Yeah. Well, thank you. We did it.
Thank you for having me.
Yes, ma'am. Thank you so much for tuning into the episode today. Be sure to stay in touch with us on socials at Sex Talk Radio Podcast. That is SEGGS Talk Radio Podcast.